Hello, welcome to the 2020 edition of RC Updates. This is Amy Hoffman from the TDN Coordinating Center, and hopefully you're relaxing at home with a glass of wine to watch these on-demand sessions. So 2020 has turned out to be quite the year, right? I don't know about you, but I sure am missing all of you RCs in person. So I'm just going to pretend you're all here with me. When the pandemic hit, many of you stepped up to help us out. CF research teams across the United States were called upon for their proficiency in conducting clinical trials. Some CF team members were helping with the COVID effort remotely by answering hotline questions for employees, like where to get tested. Other team members helped with COVID-19 study submissions, and some teams were called upon to completely switch over to COVID-19 trials. Several COVID studies were initiated in record times thanks to your expertise. 3 of our 2020 programs were put on hold due to the pandemic. RC mentoring, equip coaching, and the benchmarking programs were all dependent upon the ability to visit other sites, and with travel restrictions at virtually every center, we had to cancel these programs for 2020. We are hoping to resume the RC mentoring program this coming summer. We'll be using the matches that we already made in March. Apprentices and mentors will get more information as we get closer to the summer of 2021, and hopefully COVID-19 is more under control. Same thing goes for equip coaching. Our plan is to pick up where we left off with the matches that were made this last spring. We haven't quite yet determined what the plan is for benchmarking, though. In light of COVID-19 and all of the changes we've had to make to clinical research processes, benchmarking will very likely look different than what we'd originally planned, so we'll keep you posted as this program develops. So even though 3 of our programs were put on hold, we were able to pivot and create a few new programs for 2020. The RC Reg C Open Forum was designed to provide research and regulatory coordinators an opportunity to discuss challenges and offer solutions during these crazy times. These 1-hour forums began in early April, and they've been a platform for RCs to discuss COVID-19 and how it's affecting the conduct of clinical research. We've had 11 open forums so far, and they're now scheduled for the 3rd Tuesday of the month. Topics on the forums have included things like conducting remote research visits, home spirometry, team engagement, e-consents, and remote monitoring. We'll continue to hold the open forum for as long as there's a benefit. In May, we started having our monthly TDN town halls. This 1-hour forum was designed to get key updates on issues facing our network during the COVID pandemic. Topics that we've talked about so far have included the TDN grant funding status, current study statuses and the CF drug development pipeline, home spirometry, and we've been presenting the data that was collected from the COVID impact survey. The town halls are recorded and saved on CFCRNet for those who are unable to attend the live sessions. We do plan to continue the town halls through 2021, but probably on a quarterly basis. During this unprecedented time of clinical research disruption and the eventual reopening of the research efforts, coordinators will need to solve problems that they've never faced before. The TDN Phone a Friend program, which is actually the brainchild of Brittany Hirth, one of our Loft RC apprentices, provides CFRCs and Reg Cs the opportunity to discuss issues and ask questions of a more experienced peer within the network. Anyone in the network can reach out to one of our friends via email, and they'll answer your question or they'll set up a time to talk to you on the phone. There are 3 volunteers in the Pacific and Mountain time zones, and 3 for the Eastern and Central time zones that are acting as the role of friends. We also have a regulatory coordinator, friend, that's available for all regulatory specific questions. Our friends volunteer for a 3-month term with the option of serving a second 3-month term. The Friend volunteers meet monthly with myself and Patty to discuss any issues that have come up and to help us determine if there's anything that needs to be escalated to the national level. We do plan to continue the Phone a Friend program for as long as it's helpful. The Leaders of Tomorrow program, or the LARC program, is designed to further develop outstanding research and regulatory coordinators by strengthening their leadership skills in order to fill the local and national leadership needs of the network, both now and in the future. Throughout the 2-year program, apprentices are provided opportunities to hone their leadership skills in addition to receiving training, mentoring, feedback, and encouragement to develop as a leader. We're just now finishing up with the first cohort of apprentices and starting with our second cohort. We're so proud of the work that our first cohort has accomplished, and we look forward to working with our 7 new apprentices. I would also like to take a minute now to thank all of our LOFT mentors. This program would not happen without you guys. In recent years, turnover amongst TDNRCs has been one of our major concerns. Based on data gathered from the TDNRC exit survey and from discussions we've had during annual TDN site calls, retention of qualified RCs emerged as a priority. The CF Foundation would like to ensure that, that TDNRCs who are recognized as their exemplary team members at their research site and have the desire to continue in this field be given the opportunity to do so. Student loan repayment assistance programs are a proven, valuable human resource tool that is used in organizations across the U.S. to help reduce turnover. The Loan Assistance for Research Coordinators, or the LARC program, was developed to support promising clinical RCs or RegCs with a commitment to CF research. In 2018, the CF Foundation piloted the program in which 20 TDNRCs received awards that provided $10,000 in student loan repayment assistance. So far, 26 awards totaling $196,000 have been granted, and we are just finalizing the 3rd group of awards. The CF Foundation and the TDN have partnered with the ACRP to offer the CF ACRP program. There are 2 opportunities for professional development, the e-learning program and the ACRP certification exam. This program is offered free of charge thanks to a generous award from the CF Foundation. Over the 4 years that we've been offering this, 140 certifications have been provided to research team members in our network. So 2020 has not turned out like we originally planned. We've had to adapt rapidly to working from home, drive-through and telehealth research visits, remote monitoring visits, and the ever-present virtual meeting. But through it all, you research and regulatory coordinators have pivoted, adapted, and come out stronger. Every day, I am truly blessed to be working with such amazing people. I'm going to turn it over now to Patty, who will be talking about surviving and flourishing as an RC during COVID-19. Thank you.
Welcome to RC Updates Part 2, Surviving and Flourishing as an RC During COVID. I'm Patty Burks. I work at the Cystic Fibrosis Foundation, and my job is to support you as you build relationships with CF patients and their families, conduct clinical trials, keep the drug development process moving forward, keep CROs, sponsors, PIs, spouses, and your mother happy, all under the threat of a global pandemic. We are going to take a few minutes now to see just how you do it, how you survive and actually flourish well through times like this. I have no disclosures to make. You take into account and balance many concerns every single day. You've always done this. It's not new, but under our current stressors, the balancing act looks different. You may be experiencing health issues yourself or with your family, your patients, and are certainly experiencing the threat of such issues. Your finances may well be affected, and plans to purchase a home or pay off debt or retire at some point may have been put on hold. You may, like me, miss seeing faces and hugging. Will we ever hug again? All while you're bearing up under considerable work. An RC recently confided to me, I think RCs right now are just trying to survive. Enduring so much can stress one's mental health and leave you asking, where's the joy? 7 RCs have shared their institution's available resources and support programs. We will take a look at these, and my hope is that you will identify what is available to you at your institution and take advantage of the programs that might be helpful to you. Candy Scholl from Children's Mercy in Kansas City shared some of the programs available to her and her team. I like the breadth of these programs, covering fitness with an online class and spiritual services as well. Candy shared with me that their COVID employee wellness support team can offer brief support directly to your team during huddles. The goal is to provide resources to staff to help manage the new stressors that they are experiencing, including changes to work environment, feelings of isolation, anxiety about COVID-19, stress from managing your work and home responsibilities, and other issues that may arise. These wellness team members can help address specific needs and coordinate additional resources if needed. Meg Anthony shared what programs are available at Children's Colorado. I'm intrigued with their social justice book club. Reading and discussing great literature is an excellent way to learn and grow and challenge ourselves. Also, they have regular Zoom coffee breaks. Don't we all long for those informal gatherings with coworkers that used to take place in the lunchroom or the ladies' restroom? Meg shared that she's attended a couple of these coffee breaks and finds them to be nice and easy, plus a good way to connect with coworkers. Kate Hilliard from Cleveland shared a ton of programs available to their team. I would love to get on the UH4U daily mood booster email, wouldn't you? One program that I have not seen elsewhere but would be wonderful is the Grocery Shopping Made Easy, where you can, the Grocery Shopping Made Easy, where you can buy from local vendors and farmers and pick up your purchase at a drive-thru on campus. Wow. They also have yoga, acupuncture, massage, stress management, and so much more. Such an impressive array, all to support their staff during this unprecedented time. Colleen Dunn shared some of what's available to her and her team there at Stanford. I see they have retreat facilitation, also a unique offering. They provide educational programming around parenting during COVID. What a great idea. And in addition to these, they provide individual counseling and COVID leave of absence. So if you need to, you can care for a sick loved one. Brendan Klein from Oregon's Health Services shares his institution's programs, and right up there, front and center, is the availability of confidential counseling through their employee assistance program, something likely every institution, even yours, makes available to their employees free of charge. I did ask him about the free healthy lunches, and Brendan relayed that it isn't every day, but still, what a kind thing to do for your staff. You will note that Oregon Health has a tram that takes patients, visitors, and staff from the parking lot up the hill to their facilities. How cool is that? I hope someday to get to ride that tram. Lisa Bendy from Indianapolis also shared numerous programs available at her institution. You will notice under the Healthy IU programs, They offer on-demand videos for healthy sleep habits. I'm not your mother, but it is difficult to be the people we want to be at work and at home if we are not getting the sleep we need. They have a number of programs focused on mental well-being and mental health wellness. And in addition to this, they include nutrition and spiritual services as well. Finally, Liz Hartigan from Pittsburgh shared a plethora of programs available there. I want to highlight the first one, Life Solutions, with a 24/7 crisis line where someone is there to help you with some of the unique and urgent issues brought on by the pandemic. They also added 10 extra paid sick leave days to all employees' accounts to help should they be needed. Liz, that's impressive. You've been introduced to a lot of programs designed by smart people and caring institutions to help staff during the unique challenges brought on by COVID-19. What's available to you at your institution? I encourage you to find out. There's likely a whole lot more than you realize. What do you need to help take good care of your team? What do you need to take good care of your family? And what do you need to take good care of yourself? If there's anything I can do to help, please reach out. Thank you to the RCs who shared information about the support programs available to them through their institution. And of course, thank you to you, the RCs and Reg Cs, a resilient and strong tribe who won't even let a global pandemic stop them. Thank you.